Hello everyone, I am Dr. Preeti Sharma, Senior Consultant Pediatrician at KIMS Cuddles, Kondapur, Hyderabad. Today I will be discussing about MISC. MISC is multi-inflammatory syndrome in children. It is a dreaded but rare complication of COVID-19 in children. It usually happens 2 weeks to 2 months after recovery from COVID, though the timeline is not clearly defined. It is important that all parents know about the symptoms of MISC and when they should visit the doctor. Because even though this disease is very severe, if it is picked up on time with adequate treatment, most children will recover within a few days. If your child has fever of more than 100.4 degree Fahrenheit, your child has loose motions, diarrhea, vomitings, stomach pain, your child has a rash over the body, red colored rash, the eyes are red, lips are swollen, red, cracked, there is bleeding from the lips, or there is any other symptom like persistent headache post-COVID, there is chest tightness post-COVID. Any of these symptoms should not be ignored and you should consult your pediatrician at the next available appointment. Now, what are the symptoms of MISC in which you should waste no time and immediately rush to the emergency? Your child is having high-grade fever which is not getting controlled with medicine. Your child is going on sleeping. Even when you are trying to wake up your child, the child is not able to get up. Persistent watery loose motions. Every 1 hour your child is passing large watery loose motions. Decreased urination. Your child is not passing urine at least every 6 hours in reasonable quantity. Your child is complaining of continuous giddiness, severe chest pain or chest tightness, severe headache. Your child seems confused, is not able to recognize things properly, is not responding properly. There is significant bleeding from any side. Bleeding can be in vomiting. There could be blood in stools, continuous bleeding from the nose, bleeding from the lips, which is significant. If your child has blue or grey or white colored discoloration of the lips, the fingertips, or the tongue you feel is looking blue, then these are the cases you should immediately rush to the hospital. Now the problem happens is some children may have had asymptomatic COVID and you do not know whether your child had COVID, and then your child develops fever, loose stools and the symptoms which I just mentioned. Now these symptoms can be because of COVID as well. That is why it is important, once your child has significant fever along with any other symptoms during this pandemic, immediately consult your pediatrician, either on the same day or on the next available day. You can do that even through online consultations. So in this pandemic of COVID, do not take lightly any symptoms of fever, loose stools, vomiting particularly. Even rashes, red eyes should not be ignored. Now coming to the treatment of MISC, some children may present with very severe MISC, like they may not have any pulse rate, they may be unconscious. For those children, they will be immediately admitted in PICU, that is Pediatric Intensive Care Unit, and started on fluids, inotropes and other treatment. For most other children, if we pick up the disease in time, we will do a cardiac checkup. So MISC can involve multiple systems. That is why the name multi-inflammatory. So it can involve your heart, it can involve your stomach, it can involve your kidneys, it can involve the brain, it can involve the lungs. So we will check for involvement of each of the organs. In case heart is involved, then we go ahead with IVIG, or if the child is very sick. Otherwise, in most of these children, low dose to medium dose steroids will be helpful in the treatment. Timely treatment is very important and has almost 100% recovery. But if treatment and diagnosis is delayed, then some of these children may develop severe complications and there may be even death. So please be aware of these symptoms. Thank you.